Dr. Phophi Ramathuba, to talk about the impact of this decision. A very good evening to you, and thank you so much for joining us, SABC.
Evening, Tshepiso, and evening to all your viewers, and thank you very much for inviting us.
Was this a sigh of relief, the announcement by the president that they're going to shut down some of the points of entry into the country, among those the busiest, such as the Beitbridge border post?
Yeah, indeed, it's quite a relief for us. We must indicate that we have welcomed this decision by the president, especially the fact that when you're in the middle of a pandemic like this one, of a virus of this nature, you would remember that as a province, we were forced to deploy some of our resources, which are very limited, to go to that border post to assist in terms of screening and testing for those who are coming. Now, when it's closed like this, it means it will free those resources, and they will now concentrate on dealing with the virus within our country, because now the borders are closed. Secondly, Tshepiso, I must indicate that when you are dealing with an issue like a virus, it's dependent on the environmental sector factors for it to either mutate, or you will see it has developed either a strain like currently what we are dealing with, the so-called new variant, the 501b2. It has developed as a result of even environmental factors playing that role. So when you open your border post, you don't know who is bringing which variant into your country. That complicates the work that you are doing. That's why we saw other countries, immediately they discover that South Africa has got this new variant. They then close borders and no longer allow South Africans to travel to their countries. So we are saying we don't know what is happening. I wouldn't say because it's in Africa you will not be having these challenges. The reality is that we are a resource-constrained continent. There might be other variants which we don't know, because probably other countries don't even have researchers who can pick them up. So when you import them, you are now complicating the challenges you are facing. The third issue is that the president yesterday has started a social mobilization campaign for all our people to accept the vaccine that we will be rolling out. And we are expected as politicians, from mayors, from ward councillors, to follow suit and support the president's call to call upon our citizens to rally behind this. But now, one of the questions,
Can I just pause you there for a moment? We'll talk about the vaccination, the rollout, and what needs to be in place. But I am interested in what is happening at the border post now. That announcement was made yesterday. We know that you've been inundated for several weeks with travellers, some losing their lives, waiting to cross the border. And there's been a huge influx on the Limpopo side as well, the South African side. What is the situation now? Are the queues completely gone?
The queues are gone. The queue are gone. Today, it's really assisted when the South African side has been closed, because what was happening, Tshepiso, is that despite the fact that Zimbabwe was on a hard lockdown, when people were traveling from that side to South Africa, they were allowed to cross the Zimbabwean side and to South African side. That's why you still saw those queues. But now that both sides are closed today, we had a very quiet Beitbridge border post. Our officials now, we have already released some of the staff to go back to their working stations, because we had to redeploy nurses from Musina hospital to go and assist there. Now, as I've indicated earlier on, it then gives us an opportunity to say every single nurse must focus on every single doctor, every single healthcare worker must focus on dealing with the virus in the country.
What are the latest figures today of infections and deaths? And do you anticipate that you will see a drop, given that the border post has now been closed up until the 15th of February? Or do you still expect to see numbers climb, because there are people who would have left the province and are probably returning?
We are still expecting the numbers to continue to climb, because remember, when we test 10 people and they test positive, it means there are 20 or 50 more who are the contacts of those 10. So we are still going to be dealing with the after effects of the border posts being open, the Christmas parties and the current funerals that people have been attending in numbers. So we are still going to have to deal with those issues. So you will see the numbers will still continue before we could see them stabilizing. It's just that currently we are working closely with everyone so that we can cap. We are very worried because as a province, we are, of course, by the end of today, we would surpass the 10,000 active cases. And this has never happened in our province. And we have never thought we will find ourselves reaching this stage. We have already passed almost 39,000 of cumulative cases. So you can see that just for these few weeks of December, January, we found ourselves moving from recording 15 cases over 24 hours to recording 1,700 cases over 24 hours. So that tells you that the current variant we are dealing with, it is, of course, spread very fast, unlike what we dealt with our first wave.
Very, very briefly, MUC, is it possible to give us a percentage, a sense of the freed up resources as a result of the shutting down of these borders? And does it mean that you'll be able to do more testing, more screening, and more policing?
The fact is we have deployed 4 testing stations at the border post from our National Health Laboratory Services. These are the testing stations that we could be using in our clinics, even in our malls, where people are there. Maybe if they hear that we are testing in the mall, which we are going to start doing then, they will not be coming and crowding the malls. If they hear that we are testing people where they are crowding, they will not be able to come. So 4 mobile testing would be released for that. We are also seeing a number of professional nurses that have been deployed to support those who would also not just testing, but also screening and people with other ailments. You'll remember prior to December, there have been a lot of rumors, even some of them which were not true, that people have died. This time around, you did not hear because we have deployed professional nurses who were there to monitor and check all those commuters to say anyone with other conditions we will be able to deal with and attend to. We have been able during this period transferred so many. There are people who collapse at the border post with their own, because these are people with chronic conditions who are coming to South Africa to seek help. We've been able to transfer, I think 4 of them, we transferred them to our different hospitals with our ambulances. So you can see that also is another resource that could be used to deal with our own challenges within the country. So our simple saying to you on the issue of the vaccines episode, to say, people question us to say, will this work on this variant and what? But if you don't have any variant, you are dealing with your own challenges in your own country, you'll be able to win these people and they will be able to cooperate and support you in your own decision. So for us as the people of Limpopo, we are celebrating this particular decision by the president. We welcome it. We are saying, let's go on, South Africans, let's fight this virus. This time around, we don't have a lot of excuses. It's about ourselves now, taking care and joining efforts of government, and we'll be able to win.
All right. Thank you so much. Much appreciated. MEC Dr. Phophi Ramathuba is Limpopo Health MEC. An update on how the president's announcement that 20 of the land ports will be closed, including some of the country's busiest borders, Beitbridge border post into Musina, one of those, and Dr. Ramathuba saying is going to have a very positive ramification.